Hi, everybody, and welcome to today's webinar on navigating the heart failure journey from symptoms to diagnosis. I'm Divya, and we are delighted to have you join us for this very important discussion. We are privileged to have an esteemed panel of doctors today. Let me introduce you to them. We have Dr. Anil Sharma, Senior Consultant and Interventional Cardiologist, Professor and HOD of Cardiology from Bombay Hospital and Research Center in Mumbai. We have Dr. Suhas Hardas, Senior Consultant and Interventional Cardiologist, Pune. And we have Dr. 𝗗𝗶𝗀𝗶𝗺𝗵𝗺 Professor and Unit Chief Department of Cardiology, 𝗗𝗶𝘀𝗃𝗺𝗃 Medical College Hospital, Manipal. Now, heart failure is a complex condition that affects millions of people worldwide. And understanding the journey from the initial symptoms to a confirmed diagnosis is crucial in managing it effectively. Even with all the medical importance of HF and the socioeconomic burdens, awareness of HF is unexpectedly low in the general public. Awareness of HF is very important because controlling risk factors would significantly reduce progression to HF and reduce readmission rate also and premature mortality in HF. Now, today, our goal is to empower you with knowledge and provide clarity on this very critical aspect of healthcare. So without further ado, let's dive into this essential topic. Why is it not always good to have a big heart in heart failure? And hear from our experts. Starting out with Dr. Anil Sharma. Dr. Sharma, let us commence with the most important question. What is heart failure?
Good evening, Divya. Very important question. The job of heart is to supply blood with the nutrients and oxygen to the whole body, tissues, cells. When heart is not able to pump, it means it is heart failure. Heart failure is of two types. One is heart is not able to contract, that we call systolic heart failure. And we can see with the echo, heart failure with reduced ejection fraction, means less pumping power. Another is heart failure is diastolic heart failure, that is heart is not able to relax. Or so means heart is not able to supply blood, or even if it is able to supply blood with the increased filling pressure, that is heart failure. There are various causes of heart failure.
Right. Now, coming to Dr. Suhas Hardas, sir, what are the signs and symptoms of heart failure?
Dr. Anil mentioned about heart being a pump. And it is very aptly so because heart is responsible for pumping out the blood, the oxygenated blood, also the deoxygenated or the impure blood into the lungs for purification. Now, the symptoms and signs one must understand, they result from three things that happen in heart failure. First, because of the reduced cardiac output, reduced amount of blood going to the periphery, going to the tissues, going to the vital organs, you can have symptoms. You can have symptoms because there is a congestion, there is retention of fluid in heart failure. And third thing is there is a back pressure on various organs. So let's talk about some of the back pressure symptoms. The back pressure into the lungs because of failure of the left heart leads to congestion in the lungs, and therefore there is breathlessness. There is paroxysmal nocturnal dyspnea, which means the person wakes up in the middle of the night with a lot of shortness of breath and air hunger. Person, because there is a reduced cardiac output, can feel extremely fatigued, listless, tired, and there are back pressure symptoms over the legs leading to swelling over the legs, leading to congestion in the liver and in the small intestine, and therefore there is malabsorption, loss of appetite, etc. Now, many a times these symptoms are ignored as something which is developing due to old age. But one must remember that if it comes in crops together, then this is probably a symptom of heart failure. One can also experience palpitations, chest discomfort, etc., etc. So these are the symptoms, and signs of heart failure can depend upon, once again, various factors. One can elicit certain auscultatory findings by putting a stethoscope on the patient's chest, by looking at the liver congestion, looking at the liver span, looking at the swelling that develops because of these. So these are the signs which develop in heart failure.
Okay, fine. So we've understood what is a heart failure. We've understood what are the basic signs and symptoms. Now let us come to what are the common causes for heart failure. Dr. 𝗗𝗶𝗀𝗃𝗺𝗃.
Yes, there are many causes for heart failure. However, in our country, the most common causes would be one, heart attack related heart failure. Most of the times, the people after a heart attack, only if they are treated, that means the block removed quickly without delay, then only the heart will remain to pump very well. However, in our country, there is quite a delay in terms of removal of the block after a heart attack, and that causes heart attack in the future, months, weeks, or years after a heart attack. So this is a very important cause of heart attack in our country. Yet another very important cause of heart attack would be a hypertensive heart disease. That means the patient is hypertensive and he is not taking proper medicine for the BP to control it. So proper diagnosis and early institution of treatment by tablets and to make sure that the blood pressure is controlled to an optimal level is very important to prevent heart failure. However, if the diagnosis or management is not proper over the months and years, these patients with hypertensive heart disease may develop heart failure. Yet another very common cause of heart failure in our country is a valvular heart disease. We all know that we have been having these rheumatic valvular heart disease for decades in our country, and all these will contribute to heart failure if not treated properly. They may end up in valve replacement late in life. However, till that time, it is very important that these people are put on optimal medical therapy. Yet another common cause of heart failure that is common in our country and the rest of the world would be a cardiomyopathy. That is what, as Dr. Anil and others, Dr. Suhas said, it could be commonly dilated cardiomyopathy or a hypertrophic cardiomyopathy or a restrictive cardiomyopathy. And there also is having high incidence worldwide, and India is having its own share of these patients. And these will be forming the very common few causes of heart failure in our country.
Okay, thank you so much. Dr. Sharma, back to you. How is heart failure different from heart attack? I think it's very important for people to understand that.
A very great question, but I will extend your question to what is the difference between heart failure, heart attack, and sudden cardiac arrest? Because three terms are used interchangeably by common man. Heart failure, we already discussed, it is the muscle problem, contraction, or relaxation. Heart attack is because of lack of blood supply to these muscles. These muscles become weak. It may cause pain. It can stop. It can cause arrhythmias. It can be so many problems. So because of the increasing age, plus risk factor like diabetes, blood pressure, cholesterol, tobacco, smoking, heredity, with increasing age, there is a blockage of cholesterol deposition on the arteries which supply blood to the heart. So that gradually develops, that is angina, and then suddenly it becomes 100%, then develops the heart attack. So blood supply to the certain area of the heart muscle is zero, it is heart attack, acute myocardial infarction in medical term. It makes the heart weak. There are other reasons of heart failure also, as Dr. Tom said. Sudden cardiac arrest is an electrical stoppage of the heart. That can be because of heart attack, or it can be there are so many electrical abnormalities which can result in the stoppage of the heart. Three things are different entirely, and the management is entirely different.
Okay, all right. And Dr. Suhas, another very important question is as to why has it started happening in the young? We're talking about heart failure. What is your opinion on it?
That's a very good question. And I think 4 years back, or almost 5 years back, Times wrote a very good article about various causes of mortality in India. And it was mentioned in that article that development of heart failure and heart dysfunctions is getting commoner in younger population, especially below the age of 18 years. We all know that certain congenital heart diseases are responsible for heart failure in very young individuals, as young as 5 years, 6 years, 8 years. But certain viral infections can predispose a person after viral myocarditis or after an episode of viral infection, which tends to affect the throat, but actually takes a bite of your heart, can lead to heart failure in 3 to 6 months' time. There are certain toxins, and especially the recreational drug, what we call the addictive agents, various types of addictive agents which school children are using nowadays, can also lead to heart failure in younger population. Another important aspect that was mentioned in that article in Times of India 4 years back was that development of hypertension is also getting commoner in younger population. And in fact, the article mentioned that 1 out of 4 children below the age of 14 years develop significant hypertension by the age of 14 years, which is very, very unheard of, and it's absolutely unthinkable. And these hypertensive young adults are undiagnosed for a long period of time, and therefore they manifest hypertensive heart failure by the time they are 15, 16, or 18 years old. There are certain genetic disorders which can be responsible for heart failure in young. And this is a very special entity because, unfortunately, the heart failure is not thought of in a young population. And therefore, it is either underdiagnosed or misdiagnosed. And not only it is misdiagnosed, it is unfortunately mistreated as something else.
Right now, very, very interesting here. So you also mentioned because of this viral, within 3 to 6 months of it, there is a possibility of very young kids also getting a heart attack. So what can probably the parents or the caretakers be aware of, or, try to take cognizance of?
I think Dr. Anil Sharma just mentioned about the differences between a heart attack and heart failure. So within 3 to 6 months, what you get is a condition like heart failure, but not a heart attack. But yes, of course, the presentation of these patients with cardiomyopathy is so varied that even a heart attack can be misdiagnosed in these children. I think parents must be aware that if your son or daughter is not taking interest in sporting activities, is running away from such activities at school, preferring to stay quiet, and is very fatigued, not giving 100% in the scholastic requirements that are there, I think one parent must suspect that there is something wrong and that needs to be investigated. So overall, an abnormal behavior of a child and not what is most expected out of a 12-year-old, 14-year-old student can make one suspect that there could be something wrong seriously with the health.
Right. So I think what you're trying to say primarily is that observation, keeping the kids under observation generally is very important for the parents. Notice what is happening. Is there any abnormal activity, any abnormal behavior patterns that are emerging, which can also probably, kind of signal towards the other thing that you mentioned, that is with regards to them getting into depression and all, which is also a very big reason for this. Dr. Tom Devasia, we'll come to you now. What is the process of diagnosis of a patient with heart failure?
Yeah. So, like Dr. Suhas and Dr. Anil said, it is very important that the doctor and even the common man also can have a high index of suspicion of a heart failure. That means if a patient has extreme tiredness, breathing difficulty, shortness of breath while lying down, a lot of cough while lying down, leg swelling, and all these things when they have, then you need to suspect heart failure. And once you suspect heart failure, you need to confirm it. And confirmation is by the blood test that is quite commonly available everywhere. The blood test is called the NT-proBNP blood test or BNP blood test. Both are almost similar. They have various labs all across our country which do one or both of these. So once you do this blood test, we'll confirm if the blood value is high, that heart failure is there or not. And then obviously people will do sometimes ECG and echocardiography extra to confirm the heart failure is of which type, whether it is systolic heart failure, like Dr. Anil said, or a diastolic heart failure. And sometimes you will even know the cause of heart failure, like a hypertensive or a heart attack related heart failure.
All right. Dr. Sharma, now the next step becomes how can one manage or treat heart failure?
Very important question, Divya. As Dr. Suhas and Dr. Tom said, depending on the symptoms and investigation, first we need to diagnose the heart failure. Then management in the form of one is the prevention. That I call is a 5 mantra. Keep your mind cool, 6 hours sleep. Second, avoid tobacco, smoking, alcohol. Third, breathing exercise or pranayama. Fourth is diet, avoid the salt, excess water. And fifth is the regular walking. So this is the way to prevent, because the major risk factors are coronary disease, that is again affected by diabetes, blood pressure, cholesterol, obesity. So lifestyle important. Then medicines are there. Most important things is diuretic. So take out the water and salt out of the body. Another four fantastic medicines, what we call is a fantastic four medications for heart failure, for reduced ejection fraction less than 40, mildly impaired 40 to 50 pumping, and even in more than 50, that is a preserved heart failure, they are useful. That is a ARNI, angiotensin receptor blocker, neprilysin inhibitor, beta blocker, then SGLT2 inhibitor, and MRA, that is a mineralocorticoid receptor antagonist. So these are the medications. In spite of that, then depending on the cause, like somebody has a blockage, then we need to treat by angioplasty or maybe bypass surgery. Or if there are various electrical treatments are there in the form of implantable cardio defibrillator, or maybe CRT, that is a cardiac resynchronization therapy. There are so many other devices are also available to monitor and to treat the heart failure.
Absolutely. Now, let's elucidate a little bit more on this. Dr. Suhas, what do you think? What are the lifestyle modifications that a patient, should do to manage heart failure? I know Dr. Anil just touched upon it, but yeah.
I think Dr. Anil Sharma did mention about the broad categories of things that one must follow if one has heart failure. I'm going to go into a little more details of this. So the first important thing that one must look at is the dietetic change and the fluid management change that must be brought about in a patient with heart failure. Now, what are these dietetic changes? Number one, let's talk about the salt intake. Now, the salt intake in a patient with heart failure must be reduced to less than 2.5 grams per day. Now, how do you actually calculate this? A simple formula is that the food that is made for the entire family can be consumed minus little salt. That is number one. No added salt on top of any of the foods. Like, for example, some people are in a habit of taking salt on top of cucumber, tomato, salad, etc., etc. That must be completely avoided. And any salty food like papad, achar, kitcha, this must be definitely avoided by patients with heart failure. Second important thing in dietetic counseling is always the fluid management. The fluid that can be consumed by the patient of heart failure has to be determined by the treating cardiologist, and he may give you a daily allowance of, let's say, 1400 ml of fluid. Now, this includes doodh, chach, lassi, juice, pani, etc., everything included. So one has to stick very strictly to the daily allowance that has been allowed to you by your cardiologist. Third thing is that it has been mentioned that a high potassium diet is good for people with heart failure, but not for everybody, because there are patients with heart failure who tend to have high potassium because of the medications or because of a variety of reasons. They may have kidney disease underlying. And therefore, if your kidney functions are good and if the allowance is possible by your doctor, then it must include a high potassium diet. One must avoid hydrogenated fats, and this includes processed food. One must avoid trans fatty acids, which are there in all tali hui cheezein jitni bhi hoti hai, fried food, that must be completely avoided. Trans fats must definitely be avoided, and overall the nutrition should be very wholesome. So this is about the diet. The second thing, important thing, is the exercise. What is the kind of exercise that a person of heart failure can perform? I think an aerobic activity which is graduated, which is tailor-made for everybody depending upon his capacity, the heart function, etc., depending upon the volumic status of the individual, is very important. One must make sure that pranayam, which is a breathing exercise, must be carried out. This helps patients of heart failure to a great extent. Third important thing is the stress management. I think stress plays a very vital role because it leads to stimulation of the sympathetic activity, which makes an adverse impact on your heart failure and the heart function. Relaxation techniques are available. Listening to good music, being able to relax in between working hours, say for 15 minutes after every 2 hours, is a good idea. There has to be a good social support. So you should have some good friends that you can rely on. somebody to listen to you, somebody that you can listen to, etc. Sleep pattern. This is the fourth most important thing in a patient with heart failure. Sleep for at least 7 to 8 hours is very, very crucial. And one must make sure that one must sleep in a very ambient situation, ambient temperature, ambient bed, and maybe that one should listen to good music before sleeping. Reduction in some of the substances which are used. For example, tobacco is completely banned for patients with heart failure. Smokeless tobacco is absolutely no once again. Limit the alcohol consumption to a great extent. If you can quit alcohol, which is the best, then, as I said, do not use recreational drugs. Most importantly, you are monitoring your daily weight. You should not gain weight excessively on a daily basis. Your weight can remain within -1 to 1 kg over a long period of time, and that is very, very vital. Last but not the least, adherence to medications, and this is called as compliance. Your compliance to the advice given to you by your doctor, by your cardiologist, and the medications which have been prescribed to you is of vital importance to manage your heart failure properly.
Absolutely. So 1 kg is fairly serious. You can't just go on a little holiday and binge eat and come back. All of that is
Not
out
at
of the window. So one more question. When you talk about potassium, can you just tell us what are the few foods which one can bring into their diet?
I think green leafy vegetables, lots of fruits are rich in potassium. You can have potassium supplements and foods, especially like coconut water, banana, sweet potatoes. These are quite rich in potassium.
Okay. All
But
right.
of course, I must mention this, and this is a cautionary, that not everyone can consume a lot of potassium containing foods, because some of the patients of heart failure, they have a restriction of potassium.
Absolutely. So now another thing which is important to look at is, Dr. Devasia, if you could tell us now, how does heart failure affect somebody's daily life?
Of course, starting from diagnosis, we know that whenever somebody is having extreme tiredness, inability to perform as before in terms of physical capacity, inability to climb uphill along with his peers, and he feels breathless. And when he lies down to sleep, he wakes up in the middle of the night with sleep. All these things will affect your quality of life. Not only that you are unsure about yourself, your confidence also goes down. So it is very important that these people come to a diagnosis quite early in life. And then once it is diagnosed, they get the proper treatment and do the things that is needed to improve the overall mortality benefit, quality of life, and symptomatic benefit. All three are very important with the molecules that Dr. Anil and Dr. Suhas already discussed. That means beta blockers, ARNI, mineralocorticoid receptor antagonist, and obviously SGLT2 inhibitors. And now we have the vericiguat also, that is as an add-on to people who are getting admitted with recurrent heart failure. So all these medicines plus other lifestyle management, including a graded exercise training program, maybe sometimes a discussion with your psychologist for counseling, and maybe meditation and exercise and diet. All these will contribute along with stress management to give a better quality of life. But until all these comes into the proper position, the patient will have his quality of life affected.
Absolutely. Dr. Sharma, what is the right time? When should someone seek medical help for heart failure symptoms?
First thing is that the heart failure is described as staging A, B, C, D. A is at risk. Those who are having risk factors for heart failure like diabetes, blood pressure, coronary artery disease, valvular heart disease, they should be careful about the symptoms. What are the symptoms? As heart is not able to pump blood to the cells, tissue, muscle, there is a fatigue. You feel tired, fatigue, non-specific symptoms. When the heart is not able to pump, left ventricle is not able to pump, blood comes and it is, we call it a congested lung, or in severe stage pulmonary edema, there is a breathlessness on exertion, particularly lying down, there is a breathlessness we call orthopnea. Somebody sleeps and after 2 hours wake up suddenly with the breathless, paroxysmal nocturnal dyspnea. These are signs of left ventricle failure. Then there comes the right heart failure. If it is heart is not able to pump, then there is a back pressure, congestion, And liver congestion, there is ascites, collection of fluid in the stomach. Then there is a neck veins are engorged. There is swelling in the leg. And there is a overall blood, water collection in the body, so weight gain. So these are the symptoms which should somebody should think that I may be having blood pressure, diabetes or heart failure. Go to the nearest doctor. Already as discussed by Dr. Tom and Dr. Suhas, that do the investigation in the form of ECG, X-ray, echo, blood test, and if required, angiography, CT scan, MRI. Early detection is the best thing. Prevention is better than cure.
Absolutely. I think we have a fairly good idea now. But before we close, I'd like to ask each of our doctors to share one final tip or, just one takeaway for our audience. What should they remember as they navigate the journey from symptoms to diagnosis in heart failure?
So I'll say first, basically, one must remember that if there is heart failure, there's a loss of lots of productive years. They are called as DALYs, D-A-L-Y. Now, these DALYs will add up if you have more number of heart failure patients. And therefore, the productivity of the individual goes down for sure. But the productivity of that family goes down, because if that gentleman is the earning member of the family, it's going to make a big impact financially on that family. And now when this adds up on a larger scale, it leads to the inefficiency of the society when you have hundreds and thousands of such patients. And it leads ultimately to the inefficiency of the nation. And therefore, I think if every individual starts watching his health extremely carefully, starts leading a very healthy life, is very watchful about what that person is doing or not doing, it is possible that we can make our life more fruitful, more healthy, and more useful to the nation, because our health ultimately is the productivity of the nation, and that's the national wealth.
Absolutely. Thank you. Dr. Devasia?
Few keywords: prevention and treatment of heart failure. Sugar, BP, cholesterol, smoking, exercise, diet, stress. You take care of them, your risk of heart failure will come down. And once you have heart failure, like we already discussed, physical incapacitation in comparison with peers or with yourself as it was a few months back, then check one single blood test, 𝗗𝗶𝘀𝗶𝗺𝗏. Thank you very much.
Thank you. And Dr. Sharma?
Heart failure is of two types, systolic and diastolic. So commonest mistake is we advise echocardiography. Patient goes to the echocardiographer, he says pumping is okay. So 50% of the heart failure are with the preserved ejection fraction. So heart failure is a clinical syndrome. It may be with the normal pumping, it may be with the reduced pumping. Drugs are available. We need to treat it. Second point, heart failure, whether it is a reduced ejection fraction or preserved ejection fraction or pumping, 5-year mortality is 50%. That is more than majority of the cancers. Don't take it lightly. Lifestyle modification, as I said, pancha mantra, stress, tobacco, smoking, alcohol, salt, pranayama, walking, and diet. Thank you. Good day.
Absolutely. Thank you so much. So as we wrap up today's webinar, I want to once again extend our heartfelt thanks to all our distinguished panel of doctors for their invaluable insights. Thank you so much, Dr. Devasia, Dr. Hardas, and Dr. Sharma for joining us today. So understanding the journey from symptoms to diagnosis in heart failure is vital for both the patients and the healthcare providers. And we hope that this discussion has shed light on the complexities and provided you with actionable knowledge. Remember, early detection and diagnosis are key to managing heart failure effectively. Stay informed, ask the right questions, and most importantly, take charge of your health. Thank you once again for joining us today. We look forward to continuing this conversation in the future sessions. Stay safe and take care.